There is a development. Thank you. It's a little bit after 9. I'm going to call the meeting to order for the neighbors of Dunn County here on April 27th. And I see that we have 1, 2, 3, 4. We have everybody here with Supervisor Breslin remote. And thank him for taking time out of his conference to do that. And Supervisor Keeter, welcome back in person. It's good to see you. Approval of the minutes would be next up.
Motion.
Okay, so we have a motion by Supervisor Bjork, second by Supervisor Breslin to approve the minutes. Any corrections or additions? None. All in favor? Aye. Aye. Everybody voted aye. Is there any public comment today? Wow. Okay, then there's nothing at the request of the chair. And that would come up to Carmen then, number 6, new clinical mentor introduction.
All right. So as I alluded to last meeting, we have our new clinical mentor who started with us a couple weeks ago, and she is here today to introduce herself. So I'll let Sarah do so.
I'm Sarah. I have just started the Neighbors. I think I'm on the end of week 3. So getting under my belt all the processes that are going on over there. Previously, I've been a DON at 2 other facilities, and prior to coming to Neighbors, I was at Pioneer and Prairie Farm, where we actually closed that facility, unfortunately, and that allowed me to then transition here, which has been wonderful. Otherwise, I've been in healthcare for almost 15 years and started as a CNA and has worked other positions, hospital, as well as clinic and surgical areas. So a little bit of everything. So if you have any questions, I told Carmen I have an open door. If there's anything you think of that you would like to ask, just let me know.
Just for the rest of them, we had this little comment. You're working with, is it 4-H?
I am the horse project leader for Dunn County as well in my free time.
Which is really cool.
And leads a club.
Oh yes, and I'm also the 20 tours club leader, co-leader. There's 2 of us. But...
So Larry, did you know Sarah before this? Through that?
We've crossed a couple of times.
Okay, wonderful. Well, that's great. All kinds of connections in the community. Welcome.
Let's just say she's very passionate, to make something work with kids.
Yeah, Larry.
She's very passionate. It's what my experience in working with kids, having enthusiasm and leadership goes a long, long way in bringing that flock right with you and pushing them to the point where they do better than they would do without somebody helping them. So she's right there.
Thanks, Larry. I appreciate it.
All right. Welcome, and let's move on.
All right. Next up is the Quality Assurance Steering Committee updates. So as always, we go over the normal monthly reports. This month, we talked a lot about COVID and changes related to COVID. As you're probably aware, the federal state of emergency is ending in May. So we discussed how that affects us. At this point, CMS has not released any changes that are going to occur for nursing homes or healthcare entities in regards to masks, vaccinations, protocols, outbreaks, anything like that. So we're still waiting on that. If it is anything like how the pandemic started, our stuff will be very different and will be delayed from anybody else. So as of now, our regulations all stay the same, but we did discuss how we're going to roll things out, different changes that we can make within the regulations to lighten things up a little bit. For example, we were having our residents be able to go into facilities outside of the Neighbors for outings now. That was something that we hadn't done before. If we took residents on activities we did outdoor activities. So like going to the park, going to the band concerts, things like that. But we didn't feel comfortable bringing a large group of people into an enclosed area because that was something that could spark an outbreak at the nursing home itself. Now we are going to, at the end of the emergency, we are going to allow that as long as we have consent from the powers of attorney that they are okay with that. So we are in the process of sending out consent forms so that people can say, yes, I'd like my loved one to be able to go to the movie theater or to Walmart or wherever the activity is going. Just that way that they know what's all happening. We also discussed some changes to some policies, as well as went over our quality of life report as well. Anybody have any questions about QA?
No, it looks good.
All right. Next, we'll move on to the employment activity report, and I believe Chris is online.
Good morning. Everybody hear me?
Yes, Chris.
Perfect. So for the March employment report, that came out late. I think Carmen would have handed that out today. I apologize, I didn't include that in the packet. So if we go down through the list, March was pretty slow. We only had a couple of direct hire interviews, we're able to offer one position or offer two positions, one was accepted. Had 7 agency interviews, kind of the standard for that. If we go down to resignation reasons, that was also good. That was slow in that area also. Basically the resignation reasons were school focused, with the spring semester coming to an end and people graduating, they decided, not to come back for the summer and just resigned. The couple of them did graduate, and moved back to their hometown. So it's, kind of to be expected this time of year. So open positions, were adjusted as such. We go down to active leaves of absences. That would have been, the remaining at 6. Work comp lost hours was nothing. So that's always a good thing when we don't have any lost time. And we go down to work or missed shifts due to COVID type issues in March. Was about 21 shifts. They're 190 hours. And that also includes missed shifts for agency staff because they also need to be replaced. So I do throw them into the count. So any questions on the employment report?
I don't see any, Chris.
I will just also add, I know Chris mentioned it was a bit of a slower month. Fortunately, in the last couple of weeks, since our meetings are at the end of the month, everything is a little bit delayed. But next month, we will see more internal interviews. We actually had 2 internal people start on the same day, including a full-time CNA. And then we've had another CNA come back that had previously worked with us. And then we also got another application for a CNA, I believe, today. So there is positive news. We'll just hear it in May. All right. Next on the agenda is item D, CNA training program. I do not have any formal updates this month on this. We're still working on it. I have an email out to our contact as well, but we are still working actively on this, but I don't have any concrete updates this month, but I'll keep it on the agenda every month. And hopefully next month we will have a concrete update on that as well.
And we're still looking for a place to hold the training, is that correct?
Yeah, so we have sent in a couple of different layouts of ideas of places to hold the training. So we're waiting to hear back on our second idea. Any other questions on that? Okay, resident referral port, that would be on the back of the separate sheet. So resident referral activity report for March. We had 95 residents at the beginning of the month across campus. We had 80 referrals. We admitted 8. We had 72 not admitted. We had 99 residents at the end of the month. And we had 2 residents transfer to other facilities. One went to go live with her husband as her husband was admitted to a VA nursing home. So she was then eligible to go live with him. That one was a kind of a sad day. She had lived with us for quite some time. So we had a sad farewell, but she understandably wanted to live with her husband. And then the other transferred to a facility closer to home. We had 3 deaths in March, and then we also had 1 person discharge home. Our referral sources remain the same between the 2 local Mayo organizations and then Sacred Heart as well. We have had a little bit of an increase in census. We still have the 2 households closed, but right now our census is at 102 if you include a few bed holds. We have a few people out at the hospital and 1 person on a leave of absence just to go with family on a brief vacation. So fortunately, she's able to do that. But in total, we're at 102 as of yesterday. Any questions on referrals?
How does staffing change when you go from 95 to 102?
It doesn't. So staffing so we have not opened another household, so that would be when we would have to increase staffing. So there was a couple households that had some empty beds, primarily our memory care households. So at the time, they actually had probably a little bit extra help than they needed, but we not enough to pull away a staff person. But we increased the census in the memory care households to actually be the point where we would have 2 CNAs, which is what they were having. So it does not increase the staffing, just kind of gets them back to our normal baseline. Those households had some empty rooms because we only admit people to those households that require additional memory care services. So we wait until we have someone that is appropriate for those households. Otherwise, if they're more high functioning, commonly people get very frustrated if they're more high functioning and they're in a memory care household. So that's why those have remained a little bit more empty, but we are able to fill those because there was 2 staff already in them. Any other questions on referrals?
Supervisor Keeter.
I was just curious, you had 80 referrals, and how many of those on the average would fall into this very difficult cases, not from Dunn County, no insurance, et cetera, that you wouldn't accept normally?
Sure. So we used to actually break that out. I don't have the exact number on this 80. We used to break it out into the exact reason that we denied the referral. At this time, when we don't have an open bed, we're not reviewing them as much as we had in the past because we wouldn't review something that we know we're not going to take, even if it's a wonderful referral. In the past, we had combed through every single referral and decided if we could meet their needs or not. And then we'd break those down. So the reason we include that on there is because sometimes it has to do with that. Sometimes it has to do with COVID. Sometimes it has to do with not having a bed, but we're only reviewing ones when we have an open bed. So some of them may not have been accepted even if we did have an open bed. So we just kind of include that caveat in there as well. So I don't have an exact number.
I would guess it'd be probably more than half would be eligible, don't you think?
Correct, yeah. Back in years past, before COVID, which seems like a lifetime ago now, but when we broke it out, it seemed like we probably admitted about half of our referrals. We weren't getting nearly as many referrals, but that's also because most nursing homes aren't accepting a lot of admissions and we're seeing more and more referrals. But we would accept about half of our referrals every month. And then those were listed out as to why, based on if they didn't have insurance or any sort of concern that we couldn't care for them or weight limit, things like that.
As long as you're talking about patients or residents, about what percent are on Medicaid? Just roughly.
I believe roughly it's about at 70% right now,
That's close
60 to
enough.
70.
Okay, thank you. I've been asked that question, so I was curious.
Sure. And I can get you a more specific number as well.
If you want to, but it isn't necessary.
Any other questions on referrals?
Supervisor Bjork.
I wanted to bounce back.
Larry, your mic's not on.
I wanted to bounce back on the CNA training program.
Uh-huh.
I assume that the lack of CNAs is a statewide problem.
It's a statewide and national problem.
Okay, so in that regard, was funding for CNA training part of our legislative agenda?
It was.
Okay, and what do they say to you? I mean, I would think statewide, if people are facing the same shortages and going to the traveling nurses and all that kind of stuff that goes with that. Who does that fall to? Is there what legislative committee would? I mean, is it? It would seem to me, there has to be startup cost to, initiate a program, and then once you've got the facility and the program established, that your young people coming in or people coming in for CNA training would somehow, carry the load financially, for the training. But it would seem to me that certainly would be for the state to, for like a new startup, a new facility, a new wherever it,
So there is legislation and programs that benefit that. So WIS Caregivers Careers Program is a program that we are participating in as a facility that participates. They do both training centers, schools, and facilities. And that is a program that does supplement the trainees and tuition, I guess, for lack of a better term, the cost of the class, as well as kick back to the facility, and then also incentive for the staff member to stay at the facility for a certain period of time. We participated in this the first time that they did it as well. And it's a little bit different this time. Their structure changed, but there is state legislative action on that and programs. So to answer your question about which committee would be involved, DHS is the Department of Health Services is probably the biggest one that works on the programs, but then it all boils down to the Joint Finance Committee and the actual budget and how much money that the state legislators give to each department.
I just draw on personal experience a little bit because it is somewhat parallel. In 1988, when my farm business was sold out, I think I went to tech school in Appleton for truck driver training because there was a job that would pay me pretty good, and I got there with $40, and they had a program, displaced farmers, to get being trained at the tech school. I had a degree, but it didn't want to move. But, the state sure made their money back on me for the next 35 years for, teaching me to, get into a job and, be successful. So, I mean, it's the same concept, and it's even the same concept with the instructors. And, I always think it rings hollow when, universities or whoever it is saying that we can't put out more CNAs because, we don't have the instructors to do it. Well, if you want to use the parallel, the instructors that I had at the tech school were a combination of, people with degrees and people with a real life job experience. And a couple of nurse practice people that I've talked to, and it says, why wouldn't a position at a university where you would teach CNAs be a good move? And every one of them to those that I've talked to have said, well, it means you're not forced into working every other weekend. You're able to be off for your holidays. So, I just think that it's baloney that they can't find people to teach what needs to be taught via CNA.
The main drawback, I believe, at least what I have heard, is that the wages at a university compared to wages working as a nurse are significantly less.
Right. So
So,
sometimes you make personal family choices and the wages are second. And
Yeah.
that's what people were telling me.
I can also say, just from my experience, looking at CNAs as a whole, we are not seeing long-term CNA employees where I go to school to become a CNA, and that's my career choice the entire length of my time until I retire. We're seeing more people come in as CNAs because they're going on to a secondary schooling and they need that CNA course and experience to then complete whatever their end goal is. So unfortunately, even in the workforce, we're not seeing CNAs as a long-term employee. You'll see younger CNAs come in because they have a long-term goal of going to school for XYZ and they need this to complete that. So yes, I'll work as a CNA, but once I graduate from my actual degree, I no longer am going to work as that CNA. And I've seen that multiple facilities I've been at where I have a handful of actual long-term CNAs that are in it because of, that's what they want to do for a living.
Sarah and I are both examples of that.
Yeah. And Supervisor Witzel, you were a CNA and
Early.
turn on. Just to kind of follow up, when you were doing it, there were a lot more people that did it just as a
Oh,
CNA.
yeah, definitely.
Okay,
But then I got burnout after about 11 years and then I went secondary too.
Okay, so that's interesting, Sarah. Thank you for adding it. Supervisor Bjork, thank you. Anything else before we go on to Mr. Nabelfeld? Let's go. Scott.
Good morning, everyone. And good morning, Sarah. Welcome to Dunn County. And happy birthday, Carmen.
Just had to get it.
I had to
I
do
didn't
it.
say it.
I had to do it. All right. If anybody has been in the central building, they probably see our new fire doors that were installed. Those are in there. Still waiting upon paint to get them looking nicer. I know Carmen is cringing on that because the looks of them, but we will get there. Brady will be busy on that. I'm still working on the quotes for the buses. And we can get an IFB sent out for that, so we can get the quotes in, get that approval, get the order in, we get toward that new bus. Guys have been working on the grounds, cleaning up for spring, looking at that stuff, and they've been working on work orders. Things have been going fairly smooth right at this point. I can knock on wood on that, but going pretty good. You guys are a great help. They do a great job. Any questions?
It looks like you're off the hook, Scott.
Awesome.
When things go smoothly, there's no questions, huh?
Yeah, we like it that way. Thank you.
All right. Item G is the Medicaid rate appeals update and pre-hearing conference. At our last meeting, I mentioned that Jane and I would be sitting on a pre-hearing conference with a state judge and then also a attorney for the state from DHS regarding our appeal of our Medicaid rates for the east and west buildings. So we had that, I believe it was a couple days after our last meeting, and basically the attorney from the state stated that he thinks that all of these should be dismissed. There's several nursing homes in the state appealing their rates and saying that we can't appeal, the part that we are trying to appeal doesn't fit the appeal structure. But we disagree with that. So the judge basically said that the state's attorney needs to provide the written write-up of X, Y, and Z of his case, basically, and then we have a chance to write back on that. And then based on that, we would then have an actual hearing. We did hear yesterday from our contact at Leading Age Wisconsin that's been working on these, Renee. She actually sat on the call with us, which was very helpful, as she's done this before and also worked for Medicaid before. So she has lots of experience. We did get an email from her yesterday that several of the facilities that had these pre-hearing conferences have received letters from the state's attorney, asking them to have a motion to dismiss. We have not received one of those yet, but I'm assuming we will. Almost all of the facilities that are appealing on slightly different terms, but basically the same thing. Basically that the methodology was changed after the fact, that we submitted things, which caused a lot of havoc in everybody's cost reports. And primarily due to the fact that the state was very late on doing these this year. So basically a bunch of nursing homes are fighting the state right now. So, and we are part of it. The thing that was brought up on this email was that the facilities that had already received letters of a motion to dismiss have kind of banded together to try to have one case then basically against the state, and they have worked with a couple of different attorney firms. So if and when we receive that letter, we will be probably bringing this up again with all of you regarding a decision on if we want to join in on that with the attorneys. I have no idea what the cost of that would be, or if we wanted to attempt to fight it on our own. We'll probably do some crunching numbers of the cost of joining in with these other organizations and some attorneys that have experience doing this in the past versus fighting it on our own and involving our corp counsel, which I do not know as a fact, but I kind of doubt that Nick has experience doing this. But depending on cost versus benefit of if the cost of hiring one of these attorneys is more expensive than the return we might get from increasing our rates, it may not be worth it. It just kind of depends. We just got the email yesterday, so I don't have a lot of information for you, but just wanted to put it on your radar that that's something that might be coming up in the next months. Any
Well,
questions?
sounds like fun.
Mm.
Mm.
It's always interesting.
Yeah, something new.
Mhm.
Any questions on that, Sean, or anybody else? Okay, then we're done with number 6, down to number 7. Consideration for
We
action.
still have
Oh, COVID-19,
Yep.
H, thank you.
Yep. So H, as always, I have a COVID update. I did discuss it a little bit up in the QA section, but just an update on COVID at our facility. In March, we had one positive staff person. Fortunately, that staff person did not have contact with many residents. They had only seen one resident during their infectious period. They don't work out on the floor that often. So fortunately, that resident did not become positive with COVID and cleared that outbreak fairly quickly. And then actually last week, we had a positive resident in our west building. We tested everybody and no one else was positive. This resident does have frequent visitors and frequent outings with their families, so could have got it from anywhere. It was actually kind of a fluke that we even found out that she had COVID. She was asymptomatic, went to the hospital for something else, and it's part of their protocol to test just when they come in. So she was tested and then we were notified that she was positive. She was at the hospital for something completely unrelated. So kind of a fluke, but we have gone through the testing for that. And fortunately, no other residents have tested positive.
That's great. Do you have to test the whole?
We test anybody that they are in contact with. So fortunately with our setup of our households, our residents are typically only in contact with the people from their households unless they go on an outing or something like that. So we test anyone that they had a possibility of having contact with. So that would include both staff and residents that work in that household.
Thank you.
Mm-hmm. Any other questions for me? Otherwise, that concludes my administrator's report.
No flu yet?
No flu.
Good. Okay, then. Now I think we can go on to number 7.
Awesome.
Okay, Chris. There we go. Hello, everybody, and welcome to Sarah. Chris did send out the vouchers. Are there any questions on those vouchers? Okay.
I don't see any.
Okay, they looked pretty regular as far as when I looked them over. Nothing stood out as unusual. So going on to the financial reports that I submitted. I think first, what is first in your packet? I'll follow your packet. Is it the campus census?
Aging.
Aging is first, okay. I came up with a bar graph for the aging and went back for an entire year. Like it was about a year ago when we had that other form. I'm not sure if this is better than what I had provided in the past or what your feelings are on this.
So just to, if you were gonna show me this and I didn't know what it was, what would the very last column be? How would you describe that to me?
The very last column on the right,
Yes.
I would look for the blue area. The blue is the most current billing that we've just sent out. So you'd probably want more, you want to see more blue and orange, those bottom two bars, than you would want to see at the top. The top little skinny dark bars are the oldest aging. And the number at the top is the total amount that we have outstanding. So it goes up and down. It fluctuates with when Medicare pays their bills. If we're off by maybe 3 or 4 days on billing Medicare A for whatever reason, then the payment goes to the next month. So that blue and orange would fluctuate significantly based on just that activity. But in general, it should stay within an area.
Supervisor Keeter.
Yeah, so lower number is better.
Lower number is better.
Okay,
Unless there's a reason. We did take out the Medicaid rates that we had put in. When I did speak with our rate reviewer within the last month, he said, yes, they're still pending. Why? I asked why they haven't been published to us, the official website, so the Medicare or Medicaid HMOs can pay off of those. And he said, well, we're not doing that because we're still considering even something that they had already approved. So if they're not even going to publish what they're paying on, we took everything back. Basically, we don't have new rates. So the aging went down. If we knew what the rates were going to be, we could post revenue and then that bar would go fairly high until those claims get paid. But I took out the Medicaid rate change completely because it's so up in the air.
thank you.
Carmen.
I just wanted to add, just in case you weren't aware, the Medicaid HMOs would be things like Inclusa or My Care Family Choice. So they also haven't paid the new rates because they go directly off of Medicaid rates. So
Right. And the hospice HMOs, because they bill Medicaid and we bill them. So they haven't done even the basic increments. So that's part of that outstanding amount that it's in limbo. And that would be from July 1st of last year until June 30th of this year. And then we'll go forward with the new cost report. So this whole thing of rate, the rate issues would be for a 1-year span. So we've got those.
This bar graph makes it easy to look at it and compare. I like it.
I think it tells a different story than just numbers off of a snippet from the software. So thank you. The campus census, Medicaid, as Carmen said earlier, is at about 70% of our case mix. So that is meeting the bar. The other items are not. And I did some math here in the meantime, because you asked about what percentage the Medicaid was, which includes the Medicaid, hospice, Medicaid, HMOs. 73% year to date is the Medicaid group. Medicare A is 9% of our case mix. And then private pay is 12%.
What was Medicare?
Medicare A is 9%.
Okay.
It's a little bit lower than expected, but that has to do with available beds. You know, if we don't have any beds available, we just can't take as many. And our average daily rates with those I'm tracking as well, and those are staying to what we have projected.
Another
Supervisor
question.
Teeter, thank you.
I was wondering this upper limit here, this yellow line going across. What happens if Medicaid goes above that? Say, for instance, somebody is a resident and they run out of money and they have to go on Medicaid. And that would shoot it above this line. What would happen then?
The lines are just our budgeted projections.
Oh, okay.
So-
This isn't a,
No, there's no limit. It's just our budgeted projections. So if you look down on the blue line for veterans, it's above the line. It's just we have more veterans right now than what we had budgeted or projected. So it's just basically targets.
Yep. So we would like to have all of ours over those lines. But the one that's the furthest off is that one in the middle, the green one. So. The veterans' money has been coming in fairly regularly too. We've got our billing down pat. So I know in the past, some of that was very delayed, but they do pay. So that's a good thing.
And our rates for veterans have increased as well, which is a positive thing too. So that's, even though that's a small portion of the overall census and things, that being above our projected is a really good thing, as the rates for veterans has gone up significantly.
By about 10%.
Mhm.
Yeah. Okay, moving on to the financials. Would you like me to go detail line by line on that top box of overall campus?
I would like it if you do
That seemed to work well last time, taking it that way. Okay, so the intergovernmental revenue is the supplemental payment that we get from the state. And because the rates are kind of mixed up and the state is a little bit slow, we don't know what we will actually get. I know it'll be lower than that. Our halfway mark is at 360,000 instead of 500,000. So what we budgeted, you know, it's unknown if we get reimbursed on the supplemental payment based on our losses from the past year with the rate changes that we don't have, then perhaps supplemental will skyrocket. It's that's the unknown.
And that one for the end of this year, that we will get paid the second half of the last year's payment in the end of June, early July, and then we'll have another payment in December. So there'll be 2 more payments for this year, but we have really no best guess on what either of those will be.
Right. Then the public charges, those are our charges for the room and board and therapy, all of our regular care charges. We budgeted at 13.5 million. Year to date is 2.8, and the projection based on those 3 months leaves us short about $2 million in revenues, which is substantial. But if we look, the 2 buildings or 2 units are closed, so that's the reflection there. Medicaid rates might bump that up a little bit. I'm thinking about $500,000 or $600,000 is really what's at risk right now with the Medicaid rates. The miscellaneous column, we budgeted $267,000, and our projected end is 221. That is rent and senior meals. And I guess I don't know why it's less than normal. That didn't pop out at me before, but that is the senior meals, land rent, and anything else that happens to come in.
Yeah, you're looking at that, and senior meals usually come out positive.
Right, and that there's a breakout on that on the next page. So those are doing well. Interest revenue, that would be interest that we charge on late payments or payments that insurance companies make if they don't pay according to the timely rules. Interdepartmental, those were just some other postings. Those are zeros for the year end. Donations.
What, federal?
Federal revenue, that was the COVID money
Okay.
that we had, that we don't have any coming in this year. Those COVID funds. So we had 1.2 million and $300,000 in the past years. Donation money, the bus has a current amount of 49,715 in deferred revenue. And the $125 in the 2023 actual, that is a general donation to activities. So we do keep those separate. Salary and fringe numbers. The budget for total salary and fringe of direct hired staff, the budget is 10,177,000, and we're projecting 6,500,000, which is less than our budget by 3.6 million. And then if we go down to agency staff, that's an increase of 4.7 million. So it's a net increase in expense of over $1 million. So if we net those two out, it's $1 million extra cost above what we budgeted. Operating expenses are a little less than projected. We budgeted 3.5 and we're at 3.3, which is normal. Some of those costs come in at the very last of the year. We're a month behind in quite a few. So I think that's right on target. Depreciation is posted and the CIP expense is the bus. And a couple, the trim and maybe some other, the sign. I don't know if that's in there too. So that's the overall financials. Without depreciation, the net that's in bold, we're looking at a net loss of $3 million, just about. That'd be the 2 million short in revenue plus $1 million short because of extra expense in staffing. That would be revenue over expenses, the cash. Any questions?
Supervisor Breslin? Questions or no? Supervisor Keeter, you're thinking hard. Questions?
This 3,636,000, that'll be the projected loss. Is that real money then, or is that the depreciation and that kind of stuff in there too, or?
That includes depreciation. The number right below it, that 2,967, that
Oh,
is
okay.
the without depreciation.
So that's
That's the estimated at this point.
so
but-
2.9 million. Would that have to come out of the county budget then? Where would that money come from?
It would come from the general fund
General
is what
fund?
normally happens
Okay.
if there's been losses.
Has there been a loss this large before?
No.
It's been 500,000 or
This-
600 or.
The
for many
only
years?
the only loss that we have had was last year, that actually since 2013, the only actual cash loss was last year's loss. So this is the second year with a loss. Before that, we had always had a cash positive. There was the 500,000 was including depreciation. The year prior, so last year it was the 1.2. The year before was we actually put money back in, and above we had a net positive of over $1 million. And then the years before it was pretty much breaking even.
Or ahead. Yeah,
Ahead.
it was actually ahead by some. And then the audit reports are different. They're not showing a cash flow when you look at the profit and loss, because they include other ancillary items, and it's for financial reporting. So the two they're like apples and oranges. So this, we're looking at this sheet for a cash flow. Just as you were saying, what happens with the real money, where does it come from? Yep.
For a suggestion, that might be helpful. If you could look at some year-to-year comparisons. So where were you at? So you'll come back in May now. Where were you at in May last year and the year before? Just to see, is that projected $3 million kind of the usual? I mean, I think it's more than it would be, but how much more? It might be helpful to look at some year-to-year comparisons and see where were we at 3 years ago in May. Where were we at last year in May to get an idea about how real are those projection numbers?
Yeah, we can do that. I like that idea because we have 2 years, we have the past 2 years comparisons on here, but those are totals. Those are the end of year totals, not the where we were at that time. So that would be a good comparison. Because I believe what Chris was alluding to was there's a lot of up in the air. This is 3 months of data and not trying to sugarcoat it in any way, shape, or form. It's scary numbers. But there's so many things that could affect this either way. We could have the Medicaid rate could be worse. It could be better. We don't know. That supplemental payment could be higher. It could be lower. We don't know. The staffing question on hopefully we get more internal staff. The last couple of weeks have looked really good on getting internal staff. Recessions aren't great for anybody, but it is good for staffing. So that's something that's up in the air as well with the current economic status of our community. So there's a lot of question marks on this. So I do like the idea of comparing it to where we were at past times at this time. Larry has a.
So for
Supervisor
the,
Bjork.
Thank you, Mr. Chair. Well, we're not gonna make up the $3 billion in land rent for senior meals. But, you know, when you look over your campus census, you know, with the Medicare and, you know, we're waiting to hear on Medicare rate appeals,
Medicaid rate
Medicaid,
appeals.
Medicaid. Okay,
Medicaid is the state. I remember that because it's that long A.
okay,
That's
yeah.
my little trick.
Medicaid is state funded. Medicare is for short-term rehab, which is federally funded.
okay, so those would be sources of income that would definitely have effect on negative $3 billion, right?
Correct.
So, are we falling behind because their rates have not been adjusted? Or are we falling behind because it costs more to operate?
There's many factors there, so both. The cost to operate, staffing is a big part of it. 2 of our households are closed. Those census numbers would be a lot higher. But we are only gonna accept people we can care for, with the staff that we are able to get. So actually Chris, Jane, Jenna, excuse me, Jenna, and Beata and I have been working on kind of game plans of projections of how do we figure out at what point is it worth adding even another agency staff to make, how many beds do we have to fill to cover that kind of situation to see where is the happy balancing point? Can we open another household so we can bump those revenue numbers up without actually paying Peter to, however that phrase goes, robbing Peter to pay Paul. Cause are we going to increase staffing too much and then we're not making any money on those people? So we're working on that right now to see where that happy balancing point is, but it is both. It's cost to operate and we don't know for some of the revenue parts of it and the rate parts of it.
Thank you for coming up, Chris. Do you have something to add?
The other thing I think to like a cognizant of is this is why while we provide you with financials in April, that are only reflective of activities through February, end of February. Actual activities, payments through the end of March. Projections can be really, really wonky this time of the year. So for instance, I was just doing some quick math. If we spent $4 million a year on pool staff and we reduced that, so let's say in January, that would be $333,000 a month if we spent $4,000 for a year. If we reduced that by $30,000, so we hired some staff on the county side, we reduced the pool staff side, that $33,000 in January and February projected out for the year is $200,000. We're not going to spend $200,000. We're going to spend $33,000 that we spent in the first 2 months, or, so it's projected. So the way I would say it is, if you take $10, you say we're going to spend $10 in January, and you project $10 in January through the end of the year times 12, it looks like you're going to spend $120. But you're not. You're going to spend $10 in January because you're not going to continue that cost. So projections end up really heavy on the front side of the year, which I think is why it's helpful to look at a year-to-year analysis and say, do we always look like this? Or do we always look something like this? And then knowing, as Carmen said, that in all previous years up until last year, it still was an operating surplus. So it just caution you, it is alarming. It's not that we're not watching it. It's not that don't have my own sort of cautions, and we all do. But I think also numbers this time of the year can be really, really really, really skewed. They'll start to level out kind of mid-year. By mid-year, I'd say whether you're really trending under or not. And then later, August, September numbers start to give you a pretty straightforward picture of what your year is going to end up looking like. But numbers this time of the year can look pretty skewed.
Thank you, Chris, very much. Supervisor Keeter first.
Yeah, this is just a kind of a general question. Over the years, I was real surprised when neighbors contributed over $1 million back to the general fund.
Mhm.
Because my impression was, maybe I had the wrong impression, but I think other people felt this way too. This 500 million or 500,000 that we look at in the budget, I always thought that was something that we contributed to the neighbors to balance their books. So in other words, the county was subsidizing the neighbors. And I think other people, that never was clear to me. And I think other people on the supervisors were of the similar mind. And somehow it'd be nice if we could somehow educate us.
Yeah. So I believe, I'm losing track of my years here. I believe this was 3-4 years ago. We made an attempt to do that at a county board, well, it was at exec and county board, when we really broke down the actual operating versus depreciation. Because previously, when we had presented NDC's financials to exec and the board, it had always included depreciation. And the actual cost of the building itself too. So the principal and then also the depreciation. So I'm not sure the actual years, 3-4 years ago, we went through a process of redoing the look of the financials. So it truly showed operating cash and how the operations were going. And then that's when there's a sheet on the audit now that explains that wasn't previously there. So then that's how it got brought up. I don't believe we ever went into a deep dive detail of it in any public meeting except for NDCs at the time. But I mean, that would be up to Chris and Beata to decide if that's something we wanted to do at a county board meeting. But at that time, it was discussed in depth at NDC, but more included as part of the overall audit report at county board. So.
Chris, you could explain it better, but didn't we, for a long time, we bonded for the neighbors and the county was supposed to pay back the bonds. But the principal was always put on the neighbor's balance sheet, kind of.
Correct.
That's what you were saying.
Correct.
Right.
And-
So kind of way back in history, in 2009, there was a referendum passed by the voters of Dunn County that subsidized with levy the neighbors. It wasn't the neighbors then, it was the Dunn County Healthcare Center for $500,000 a year for 5 years. Then the neighbors was built, and the neighbors was the plan, just the financial plan for the neighbors was that it would generate sufficient monies to cover both operating and whatever debt was necessary in order to build it, which was probably ambitious. Well, we know it was ambitious because it never worked out that way. And as Carmen would be adept at saying, part of that was it's like building a brand new facility when you already had a facility, but you got no credit for the facility that you already had. So this building was the healthcare center. Essentially, the county said, take on all the debt for building a brand new building. And we're not going to, they didn't get
They
to
didn't
spell
buy-
this. Yeah, they didn't buy,
Buy
so
it from the neighbors.
so then they assumed that debt responsibility. And then basically we're able to have an operating surplus each year, except for that debt payment. Well, except for that debt payment and depreciation. Depreciation is not, it's so complicated because it isn't a budgeting issue. It's a balance sheet issue. It basically says, you bought all this new equipment, you bought all this stuff, 5 years later, you want to sell it. Obviously, everything isn't worth what you bought it for that day. How much is it worth? And it takes that amount off each year as the time goes by. So depreciation isn't an operating expense. And we actually took it out as an operating expense in our budgeting process because we're never going to pay it. We don't have what's called funded depreciation, which means we would set it aside. We just have our building and its stuff is just going to be worth less as time goes on. So then in 2020, then the county refinanced the remaining $13.9 million of construction debt, the bonded debt, and assumed that as a county responsibility. So I think it's just kind of in full disclosure, there's really 3 parts to it. There's an operating budget, which is one component. There is depreciation, which is a balance sheet issue and not an actual dollar amount paid anywhere. And there is the debt service for the bonding. And they're really separate considerations, but obviously they all come together. So if you want to say, well, does the county subsidize the neighbors? Yes, in the sense of making the bond payment on the debt. But up until last year, as Carmen said, the operating operations were always in a surplus status.
Last year and 2013, the year the building was built.
Yep.
Those 2 years.
Thank you. Yeah, it's probably just me, but I've never quite understand. I don't think we depreciate this building, do we?
No, because
Or the,
it's not a
Enterprise.
business, it's not an enterprise fund.
yeah.
We
no,
do
it's-
depreciate the highway building because they operate more like a
oh,
enterprise. We depreciate the equipment in highway.
And Supervisor Keeter, I do not think it is just you. This is a very complicated,
yeah.
multifaceted problem that we have been trying to level out and make it as straightforward as possible. I do not think it is just you, so don't worry.
Okay. Thank you.
The other thing that I think is worth, without getting too far into the weeds and we were talking about this in other settings, and I think it's really important to mention because again, without the details, I'll just tell you that Carmen's group is experiencing now in March of 2020, when all COVID activities came into play, Medicaid ceased a deep dive into people's finances and eligibility types of things. So if you applied for Medicaid after March of 2020, basically you applied and you got it. Your finances weren't reviewed, there weren't questions asked, you received that coverage. With the end of the public health emergency recently, there was a rollback of that. And now you have to go through the process of determining if you remain eligible for Medicaid. So people have across the board, not just long-term care recipients, but anyone who's been receiving Medicaid up until now for the last 3 years has not had to do any eligibility determination of that. They just received it. So if you can imagine, because all of our financial situations change over 3 years period of time, there are people who now are no longer eligible for Medicaid because they, their financial situation has changed and they're going to lose their Medicaid coverage. And they may well be people that are at the Neighbors of Dunn County or visiting our behavioral health clinic or receiving public health services or all of those sorts of things that we charge fees for, who have had the, I'll just say advantage if you see it that way, but have had the benefit, let's say it that way, of having Medicaid coverage for the last 3 years and now are losing it. And it will probably have a financial impact on the county.
Thank you, Chris. Everybody ready for Jane to go on? Any further questions? Thank you, Jane.
The agency staff financial report is on page 3 of 4. And the detail is there. You requested that last month. So we broke out CNA, RN, and LPNs by building. And then the summary is that middle shorter chart. On the bottom, the third chart, you have the total agency staff plus our NDC direct hire staff. Total projected charges for total staffing is 10,600,000 and the budget was 9,400,000. Any questions on that? Kind of covered that on the first page where the difference in staffing showed up to be about $1 million there. So then on page 4 of 4, we have the senior meals without overhead. When we priced this out, the expenses that show up in SAP on this chart don't include like the other overhead that generally gets reported on those other statements. So this is more of a cash flow. So we're really not making a profit off of senior meals. Pretty much a break even, and that's what the intent was. So they're pretty healthy with their revenues, which is good.
Yeah. Just to add something to that, the main intent of that is considering senior meals is another county entity. It doesn't make sense to have one county entity make money off of another because it's all a county project. So breaking even is the specific goal of that.
And the depreciation report is here. It duplicates what was on the front page. And that concludes the financial report.
Anyone? Questions? It looks like you also are off the hook, Jane. Thank
Thank
you.
you.
I like, you did a nice job again.
Chair, can you add one thing?
Sure. Carmen.
The only other thing I would add, because it is not on here, as we have not done this in 3 years, but we included on things that are ending at the end of the public emergency, public health emergency, is the need to not renew our restaurant license without an inspection. So we do hold a restaurant license for the bistro. We will be renewing that as we do hope to open it. The other downfall of that is just the staffing concerns too. The staffing concerns aren't limited to healthcare. It's definitely a bigger issue in healthcare, but we're also having some troubles with any other sort of staffing. So it would require an employee to be hired for the bistro, but that is in the plans after the public health emergency is over, and we feel a little bit more confident in making sure we're not pushing any boundaries on regulations or anything like that. But we will be, just got an email from the health department that we will be having an inspection shortly to renew our restaurant license as well. So those might be showing up on these reports if we are able to open the bistro again.
People will be looking forward to that, I imagine. Yeah.
Yes, every time we have a fundraiser sale, everyone goes, when's the bistro opening?
Okay. Well, if there's no questions on the financial reports and the vouchers, I would accept the motion for us to accept the financial report and vouchers. Supervisor Witzel moves. Supervisor Keeter seconds. All in favor? Aye. Any opposed? None. It passes. Thank you. And our next meeting time and date would be,
The May 25th at 9 a.m.
any announcements, any questions, anything in general before we sign off? Okay, thank you then. We are adjourned, and Supervisor Breslin, good luck today.
Oh,
along
thank
with
you.